Good evening, folks. We're apologizing for starting a few minutes late. We had a little technology issue. This is the August 25th Board of Ed meeting, and the first item on the agenda is Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So it's nice to see everybody this evening, and I don't see public comment. Oh yeah, okay, the next item is public comment. Is there anybody who has signed up or called in to speak under public comment? Not hearing, so we'll move on to approval of the Board of Ed meeting minutes for July 28th, 2021. Paula made the motion.
Second.
Seconded by Ilda. Is there any discussion? All those in favor of the minutes, please indicate by raising your hand. Any opposed?
I wasn't at the meeting, I'm abstaining.
Okay, and one abstention? Any other abstentions? Okay, thank you very much. And now we're on to superintendent's reports, and I'm going to hand it over to Dr. Youngberg.
Okay, the first thing I need to know is, did we actually get the technology up and running, or am I just going to skip celebrations right now and go right to COVID-19 without the technology? Do we know? Okay.
Okay.
What is that? We decided it's a rattle.
I saw myself.
There we go. And it happened again. Okay, so.
If you skip celebrations, Laura's running copy.
Okay, that's what we're going to do. We're going to skip the celebrations part and do the COVID-19 update, and then we'll get the hard copy of the celebrations.
Thank you. Sorry about that, folks. We have the superintendent running around.
It's all good. That's right, I need it. All right, so unfortunately, we thought we were going to be able to get away with not having COVID-19 updates. That does not appear to be the case. I feel like we're going to probably have regular COVID-19 updates moving forward. So you'll be familiar with the format. We've done it many times before. First page is just a slide that shows the case rates in our surrounding towns. You'll notice that Windham is sort of smack dab in the middle, with 12.5 cases per 100,000. We have surrounding towns that are slightly above us at 13, and then 13, 16, 21, and 22.5 cases per 100,000. And we also have towns around us that have less than 5. So this is just to give you an idea of where Windham falls in the surrounding towns. On the next slide or page, you'll see a familiar COVID dashboard. It will exist. We will continue to do our daily COVID meetings and update the COVID dashboard. I do have to shout out to Suzanne Craw and the nursing staff that make this possible for us, as well as Laura Perez-Handler, who is behind the scenes working the dashboard on a regular basis. Thank you. We have a relatively low number of students and staff either in quarantine or isolation right now. So you can see the numbers at the top. 1 staff member in quarantine and 2 students, and 1 staff member in isolation. So those numbers are low. We'd like to keep them that way. Also on this page, you'll notice is the total number of cases we've dealt with in the district, as well as cases that have been resolved. So we'll continue to keep the board updated on this.
Dr. Youngberg, I have a question about that. I mean, I know we have to, pay attention to privacy and whatever. Is there any way we have information on the cases that we have, whether they're vaccinated or unvaccinated?
So as of last week, we were given the go-ahead to start the collection of figuring out who's vaccinated and who's not, both for students and staff. So our school nurses are charged with getting that, or will be charged with getting that taken care of. We have a meeting tomorrow where we're going to plan out exactly how that's going to work in terms of collection. And the state is going to be rolling out a database for us, but I think we may be able to use our own in the meantime. But we will be keeping track of who's vaccinated, especially now with the governor's new executive order, which we'll talk a little bit about in this slideshow.
So we will be able to report of the positive cases that we have, how many of those are vaccinated or not vaccinated?
That is
Okay.
correct. And
Thank you.
actually, the vaccination status, it triggers whether or not you quarantine. If you're vaccinated and asymptomatic, you do not need to quarantine if you're identified as a close contact. So that's one of the reasons why it's so important for our staff to be, well, for everyone, but for our staff in particular, because the teachers won't have to go home even if they're identified as close contacts, as long as they're asymptomatic. So yes, we could report out to you how many of the positive cases are vaccinated or unvaccinated.
You need to press your mic.
I apologize. It occurred to me in the same vein of asking who's vaccinated or not. Is there any way of saying, okay, the students are from high school, middle school, elementary school in general, like a general statement to see if the cases are increasing in the younger and younger kids? Just asking.
So we've always reported out when the cases impacted a learning community, we would tell you the location of that learning community. We didn't report out if there was no impact, but that's been something we did all last year. We would say a positive case was found at such and such elementary school. So that was a regular occurrence. And I'm sure we're going to be watching just for that, because we know the vaccine is only available to students who are 12 and older.
Thank you.
Next slide is just a review of the fact that we are still under the governor's executive order 13A, which mandates masks in our pre-K to 12 schools. The governor took the commissioner of Department of Public Health's advice when they put out that executive order and specified schools will stay with masks on. Even though the governor came back on television a week or two ago and made the announcement, this executive order has already been in place, and it actually goes through September 30th. So we're mandated to wear masks. And there are obviously opportunities if families feel like their students can't wear a mask and that they need an accommodation of not wearing a mask, they should see our Director of Pupil Services, Mrs. Suzanne Craw. And if you are a staff member and you feel like you can't wear a mask, you should see Human Resources to go through the process of determining if you qualify for the accommodations that would allow you not to wear a mask. One of the things that the attorneys have let us know, and I sent the information to the board members in your packet, since it is an executive order, it's essentially a law. So if you choose as a Board of Ed to defy the law that the governor has put in place, you actually take on the risk of being held personally liable for anything that goes wrong as a result of breaking that law. So we want to follow the mask mandate. I don't think there's anyone that really can say they enjoy it. I know I don't, but it's what the governor has told us we're going to do. So I think it makes sense for us to follow what the law is. Any questions so far?
I just want to say, I want to thank you for sending that legal opinion to us. It was very helpful.
I agree. It sort of puts it all in perspective for you. The next executive order that just came out last week is the Executive Order 13D. I actually think I referred to it incorrectly in our little video, but we'll talk about that. This is the executive order that mandates that all state employees, school staff, and that's pre-K to 12, and child care providers must either be vaccinated or take on weekly COVID testing as of September 27th. We are still waiting for the legal advice from Shipman and Goodwin about this, and we haven't had any conversations with our employees yet. But we were told by CAPS that the legal advice should be out in the next day or two. So I'm expecting it. I'll share it with the board as soon as I receive it. And that advice will help us determine how we're going to communicate with the staff members about how this executive order will work in Windham. One of the things I can tell you from our clinics that we ran last spring is we vaccinated 72% of our staff last spring. So we're starting at 72%, which is a decent number. And we also know that we had a number of staff members who reported to us that they weren't going to take part in our clinic because they were getting their own vaccines. So when the State Department of Ed asked me to estimate where our staff vaccination numbers were, I said that they had to fall somewhere around at least 75 to 80%. And, you know, it's truly an estimate, but I think we do have around 75 or 80% of our staff vaccinated, so there won't be a lot of staff members impacted by this executive order. Although 20% of 700 is still a fair number of people, so more to come on that, and again, we'll share the legal advice when it arrives. Next slide is just a reminder that there is no virtual learning as a full-time option this year. The board, officially made that decision on May 12th, and trust me, you're not alone. The state of Connecticut keeps using the term. They want to see 100% of our students, Connecticut students, in person for 100% of the school year. That is their goal. So they don't want anyone relying on a full-time virtual learning option, which is why all the boards of ed were making those decisions. I do want to let families know that if you're uncomfortable with the situation, you really have two options if you don't want to send your child in person. The first option is to contact our Director of Pupil Services, again, Mrs. Suzanne Craw, to see if your child qualifies for an accommodation. The other option is homeschooling. I just want to say we want our kids in school. We don't want families to pull their children out for homeschooling, although we understand it's your right to make that decision. Those are really the only two options because we are offering in-person learning only. Questions about that? Next slide is just a list of the mitigation strategies that the State Department of Ed and the Department of Public Health are reminding us to follow in the fall. The first strategy, what they keep calling their number one prevention strategy, is to get vaccinated. So we're going to keep saying it and offering opportunities. And in fact, yesterday, as part of the celebrations, you'll hear at our backpack giveaway, we actually had a mobile vaccination clinic right there. So the parents could pick up backpacks and pull their car up and get vaccinated if they so chose. So we're working on trying to make that opportunity available to the town members as often as possible.
Were there a lot of people who took us up on the option of getting vaccinated, or were there mostly backpack pickups? Do you have any idea?
I think, go ahead.
I don't need like an exact number. I didn't expect somebody
I'll
to
let
stand there
Mr.
and count or
Camacho
something, but
respond.
was it taken advantage of?
So I believe we had about 20 plus individuals who decided to get vaccinated. That came for the backpack as well, but about 5 or 6 families came just for the vaccination, so it was a good number.
And I always say, like, every single one matters, right? So it gets us a little bit closer to that. So vaccination is the number one prevention strategy. Obviously, we're all masking, and we'll continue to do that. We're going to social distance to the best of our abilities, and remember that they changed the social distancing to 3 feet in our schools. We're going to continue washing our hands a lot, cohorting where possible. We're continuing to make sure our ventilation, HVAC systems are working appropriately. We have a second study underway right now with Tucker Mechanical, which is what the state recommended recommended all the schools potentially take another look at their ventilation systems. We're going to continue to remind our students and staff, if you're not feeling well, please don't come to work or school. We're obviously still involved in the contact tracing, isolation and quarantining, cleaning and disinfecting. Although one of the things that DPH did make it clear to us was that surface transmission is not something that they found to be an issue. They basically told us we do not need to do heavy disinfecting. Clean every day, but they said the cleaning could really be just soap and water. Baby wipes are an example of a DPH-approved cleaning solution. So they said to spend less time disinfecting. It's not a place where they saw heavy transmission. Screening and testing is another mitigation strategy that the state offers. Just letting you all know that we made the decision. I spoke to the town officials about this. We will not be offering screening and testing inside our schools. That was what the option was. They were going to set up a testing site inside our school buildings, and it may be really uncomfortable because we're a school and not a medical facility. But I did speak to the town manager and Mr. Licata just to find out, to make sure that we had enough sites around town for families to take advantage of. There are at least 3 sites currently open, and they said that they would open more if we needed to, and that it wasn't necessary for us to open a testing and screening site inside our building. So that is the decision that we're moving forward with, which I'm very happy about.
Katina and then Tracy.
Yes, as a person who was helping others get tested this past week, I would encourage the school to notify which are the places and the days that they service, because most of them have to have appointments. Urgent care was the only one that did first come, first serve, and did it right there and then. But you have to make appointments.
Okay,
for
so we can
testing
put out a
now.
flyer that specifies
Thank
the
you.
locations and
Just
times.
saying that
Good
it's
idea.
not as easy as before.
Okay.
Is the Shipman and Goodwin opinion on vaccinations and testing and stuff that we're expecting for our staff, is that going to include whether we're obligated to provide the testing if they choose not to get vaccinated? Or is that something that's just assumed isn't our responsibility?
So I know that that topic is on their frequently asked questions, so I imagine it's going to be addressed in the legal advice, because it is on one of the things they've been repeatedly asked about. Do we have to be the ones who are providing the weekly staff testing? Do we have to pay for it? Does it have to happen outside of their work day? All those kinds of things I think are going to be addressed in the advice. And if not, we're going to ask for the details from our own attorney. Please follow up with.
Right.
Yeah,
Okay.
because there's a lot of questions that come out
Yeah,
of
I can
it.
think of a million of them,
Right.
like, if, we can't force you to get vaccinated, I understand that, but then do we have to pay for your tests every week? Do you have to take time out of work to do them?
Right,
those other
and if
kind of
you
things.
refuse to do it, what happens next? Like all those things. So, yep, there's a whole series of things.
Is there specificity around rapid testing or PCR testing?
So that's another great question, which I'm
Right.
sure if it,
There's
again,
a big difference.
if it isn't addressed in the legal advice, then we will ask Jessica Ritter for follow-up.
Thank you, because that's real important.
I believe there is also an element of privacy, of confidentiality. So that's what I understand. If you do the testing, then nobody is supposed to know. It's supposed to be a private, confidential. Because if you see somebody being tested, you may figure that they have not been vaccinated. And then, so I don't know
Yeah.
what the rules are, but
I don't actually know either, Dr. Gomez. I do know that we're allowed to now ask if they're vaccinated or not, which was just told to us last week, so I'm not sure. But I definitely am going to ask the question because I don't want to violate anyone's privacy. Okay. Next slide is just to tell you that we're going to continue with our COVID compliance feedback form. That was really for the staff members. They wanted to make sure that they were feeling as safe as they could be in their work environment. We dealt with 24 submissions last year between February, when we opened up the compliance feedback form, and the end of the school year, and that's just a breakdown on your slide there of the types of situations that we had to deal with. I think by now we should be in the swing of things and understand the expectations. So I hope to have less COVID. Not that I think 24 is a whole lot, but it's enough. I think our staff members understand now the importance of staying on top of the health and safety requirements to keep everybody safe and healthy. Last slide is just a reminder, and it's going to be mentioned again in the district celebrations. We have a new website. We have a new app. We're in the process of sort of revamping and improving the way we communicate with families and connect with families. You see my little Bitmoji there. Right. Is that funny? So funny. So, yeah. So we did the first of a doodle video. I don't know if you had a chance to watch it, but on our website, you'll find a doodle video that goes through all the mitigation strategies and the things we're putting in place to keep the students and staff safe. And it's my voice and my Bitmoji. And thank you to Laura for putting it together, and for Janet for the behind-the-scenes support. It's just one of many new ways we hope to start communicating with families, fun ways. And by the way, I think that it is much easier to watch a doodle video where they're drawing out the things. I think you automatically pay attention differently than if you're just listening or if you're watching someone talk to you, so hoping it helps. I don't know what that is.
It's just cheering you on.
That's what it is.
Yeah.
All right. All right. Any more questions on the COVID update before I move on to celebrations? Okay.
Thank you.
So celebrations, as I mentioned, the very first slide is to announce the district has a new website and communication system to help reach our goal of improved digital communication. The app, I think, is the most important piece of our celebration because we know that everybody has a phone. The whole world has phones now. So if you can get information to families pushed out through an app, just feels like it's going to be a lot easier to get them to respond to what we need and make sure that they're in communication with us. Well, I'm sorry? 99.9% of the world has a phone. There you go. That's pretty close to 100%. I'll take it. I didn't realize they were busted on you, Mary. That's
No, no. Yeah.
Oh, okay. I already let the board know, and you've seen it on some of our newest releases. We have a new district logo that was required quality image requirement for our graphic designer, but it looks great. So we're happy that we have moved the frog along.
What do the stars mean?
The stars actually were deliberate. They're tied back to our portrait of the graduate, which is in the constellations, and they have each of the stars is a characteristic that we hope our students have.
I know.
So the stars are tied to our portrait. I don't know why there's 13. That's a great question. Well, there you go. And I guess that's the answer. I don't really know if that's the answer, but okay. Janet said yes. I knew that it. Perfect. All right. Good to know. Okay, on the next slide, you'll see, I know they're smiley faces even though they're covered by masks. Those are our 10 visiting teachers from Spain who will be in our dual language classrooms and/or Spanish interventionists. They are going to be placed or are placed at Sweeney, Windham Center, North Windham, Natchog, Windham Middle School, and Windham High School. So we welcome once again our visiting teachers from Spain. Very happy to have them. And by the way, if you got to see the convocation video, the dog in the video that Marty McFly takes out of the closet belongs to one of the teachers from Spain. So they did, and he was
And his name is Junior, by the way.
so cute.
That's the dog's
Adorable.
name.
No.
Nope.
No.
That would be funny if he was.
Next slide. Again, you'll see my Bitmoji, and you'll see. I know it's kind of cute, right? We also, obviously, we published the safety video that I mentioned, as well as our safe return to in-person instruction. Both can be found on our website. And we hope to continue to keep families informed of all of the lovely things that come along with reopening schools during COVID. Next page, we got a few pictures from our backpack giveaway. About 350 backpacks were given away yesterday, and we think somewhere between 20 and possibly 30 vaccinations were also given out. So a successful day. And then just a reminder, we also held a clinic this past summer where we had approximately 35 members of the community got vaccinated. So slowly but surely, we're trying to encourage anyone who's 12 or older to get vaccinated, and we will help them find those locations to do so. And last but not least, we have to say thank you to the Seroptimists who donated backpacks to Windham Middle School. So thank you very much for that generous donation.
That's a great report. Any questions, comments from the board?
Thank you.
Okay. I just, think Robinson Camacho deserves a lot of credit for getting out there and doing all the work he does in the community. Thanks for the backpack work.
It was actually a team effort. Everybody here helped, but thank you.
Well, we shouldn't be surprised by that. But
And then it looks like we're up to staffing update.
yeah.
And the board members all received a staffing report in your packet. I don't know if you have any questions specific to the staffing report, but if so, fire away.
Anybody have any questions? There was a lot of information in that report. A lot of work still to be done on filling positions.
Yeah, so one of the things I can let the board know is, first of all, we brought on additional staff through the ESSER funds to sort of triage and support our students following COVID. We have a number of students who haven't been in school for a year, so you can imagine what that transition might be like. And we know that the students who were in the hybrid model didn't get to be with their teacher as much as they needed to be with. So we feel like we need additional supports to really do a good job of making sure kids are back to where they need to be. We have some plans to accelerate achievement versus remediating it. But so there are additional staff members in this year's staffing report that you may not see in years to come. We're really trying to figure out how to get us back to where we need to be. We also continue to lose staff members in the district because they can go elsewhere and earn more money. So I want to say that because it's going to play into how we set up the budget for next year. And I keep having that conversation with everyone that is willing to listen, that we've got to offer competitive salaries or our best people won't stay with us. So I don't think anyone here on the board doesn't agree with the need for us to do that. I just want to make it public that we are working to offer a competitive salary because the work that's done in Windham is difficult work, right? We have a lot of challenges as a district, so you should have a competitive salary. So we're working on it so that we can see less people leave for that reason.
What can we do about it as a board?
I guess just when it comes to budget time, when we are explaining to the town why we need a certain amount of money, that they understand the need to pay people appropriately, and that's your staffing costs are approximately 75%, 80% of your budget. So it's really important that we get the budgets we need to cover costs.
But that is also a contractual issue.
That is true, and so we're working from a negotiation standpoint to offer, and I know I'm looking at Stephanie, our HR director, and then Tracy, who happens to be the board member who's involved in that process. We really are trying to negotiate competitive wages into each of our salary contracts moving forward. So you're right.
So how many positions do you still openings?
So that's a great question. I don't know if we have an exact number of how many openings.
Percents? 40
40 openings, I think it said.
But that was on Friday, right? I don't know if that's still the case now.
Okay. Can you press the mic, please,
she has
because
one.
people can't hear you.
He doesn't have one.
Thank you, Stephanie.
Press it so it's green.
Oh,
There you
you
go.
can hear me, okay. All right, so we probably have maybe still about 40, only because we are posting and we're hiring, and that was as of Friday, but we still have postings that are going live every day. So it probably still remains at 40.
Okay. We can get you an updated list.
Yep.
Once we get the school year kicked off.
I mean, I don't, do people want an updated list before our next meeting? No,
Okay,
I mean,
that
we could
works
just
too.
get a report when we
Appreciate that.
meet next, yeah.
Dr. Gomez, if I may, to your question, we have teacher negotiations, teacher
I
contract
think you need to
negotiations.
move it closer.
You saying I'm not loud enough? I've never heard
No,
that
you
before.
aren't.
I know we have teacher contract negotiations coming up this fall, so that'll have a big impact on where we move them. And Jessica Ritter and Stephanie will come to you with, prospective increases and stuff like that when we've come close to a settlement.
Thank you.
Okay, last but not least is the draft agenda for the board retreat. There was a draft agenda included in your packet. Our hope was to get feedback from the board members about whether the agenda works for you, if you see something that you don't want to spend as much time on, or maybe you see something you're thinking about something you want added. I'll defer to you, Lynn, because I know it's sort of your show, but.
So I just really want to stress with board members that I checked with all of you, and I think this works for everybody. We're going to be starting at noon on September 10th, which is a Friday, and wrapping up around 5 p.m. on that Friday, and then reconvening on Saturday, the 11th, from 9 a.m. to 3 p.m. There'll be a light breakfast and lunch provided on Saturday, and lunch provided on Friday, and it will be at the Windham Middle School Library and Media Center. So, first of all, does anybody have any problems with the timing of this? No, okay. We tried to put together an agenda that gives us time to do things that we need to do, particularly so that we all are on the same page around things that are happening in the district, and we're getting a chance to really have discussion and give feedback. Now, some people may look at this agenda and say, well, we're not talking about this or that. We can add things to the agenda, but that means that gives us less time to actually do working and talking about things. And I want to remind folks that we are going to be having more working meetings of the Board of Ed this fall, starting this fall, going back to that model. We got sort of away from it during COVID, but I think that there are a lot of issues that we still want to address, so my goal is to try to parse them out over the fall, and so that we set aside time at board meetings to do some of this work too. So we don't have to achieve everything at the retreat, but certainly I'm open to comments from folks. Katina?
I was wondering if within the district strategic plan, we can, since it's embedded in what we want, who we want to be, we can discuss the diversity and equity mission and vision for the district. Because I would say that is like the root, right, of who we want to become. So just to do that. Is that okay, Dr. Youngberg, if it's okay with everybody else?
Yeah, we can definitely update the board on where we are with that and have a discussion about it, sure.
How it's infused through everywhere.
It absolutely is.
Thank you.
Anybody else have anything they want to bring up? As you can see, we spend a fair amount of time on Saturday dealing with issues like the evaluation process in the morning first thing, and then we go into talking about the school consolidation, and that's the main item for the day on Saturday, and we really want to dig into that and spend time. We haven't spent a lot of time talking about that issue since our last retreat, really. There's been a subcommittee, an ad hoc committee working on it, but there haven't been a lot of board-level discussions about that issue. Tracy, did you want to say something? Okay. Anybody else? So if you think about this, in the next few days and you have any other thoughts, please reach out to me about it. I know school starts tomorrow, and I don't want us to distract Dr. Youngberg too much from what she needs to do with the rest of her team to get things up and running. But I'm happy to talk to or hear from any of you. Okay? So the next items are the finance and audit, are the committee reports, and Mark Doyle was at the previous finance and audit committee meeting this evening, but for health reasons he couldn't be here with us, and he sent me, if you guys will excuse me, he sent me a text of what he'd like to report. Okay, the finance and audit report. We ended 2020-2021 with more than a $1.2 million surplus going back to, with a $1.2 million surplus going back to the town, which we took action on at our last meeting. He also wanted to share with you all that we pre-funded monies for 21-22 into the workers' comp and health insurance reserve funds. And at that meeting earlier this evening, Rita agreed to prepare for us a cheat sheet with all those numbers and share it with the full board, so we all have those numbers at our fingertips. He also wanted me to report that the Board of Finance at their last meeting, which was on the 18th of August, which Rita, Dr. Youngberg, Mark, and I, and probably Neil or some other people were at. We attended that meeting because we've been asked to, be present at the Board of Finance meetings to continue the conversation between the two boards on financial matters. But at that meeting, we also heard from the auditor, who gave a overview of the audit. And we wanted to report to you all that on the 18th, the Board of Finance voted to take $2 million from the Health Reserve Fund and move it into the town's undesignated fund balance. And, yeah, okay. So, the discussion was around how healthy the Health Insurance Reserve Fund is and where the town's undesignated fund balance is. After discussion, the Board of Finance, after hearing from the auditor, Chris Johnson, decided to vote to remove $2 million from the Health Insurance Fund, Reserve Fund, and put it into the town's undesignated fund balance. The rationale that was given was that the Health Insurance Reserve Fund is more than enough well endowed, and that by moving money into the undesignated fund balance, it benefits the town's taxpayers because we're going out to borrow money, we get a better bond rating, we get a better rating, and the cost of borrowing the money that we're borrowing is decreased by a healthier fund balance. It was reported that the recommendation for fund balance are, I think, 10 to 16% is what the range should be, and we're at the very low level of that right now. So the idea was to replenish that. So that was what we wanted to make sure the Board of Ed understood happened. And Mark also sends along a note saying that we recommend that the board, in the action items this evening, approve the year-to-date journal transfer report. Ilda?
I have a question. It's probably a question that, it's probably an answer I got before. You can hear me. But anyways, I've never heard that either before. You're not loud enough. Now, where does this undesignated fund go to? Now, who can apply for this?
I know.
No, this is a reserve fund. This is a reserve fund for the town, Ilda. Towns have these funds. This is money that gets put into there, so in case something comes up that you need money for, you have it.
So the school can ask for some of that back.
In the past, the school has gotten instruments out of this fund, textbooks. If it's something that the town doesn't want to add to our budget, thus increasing our MBR,
It'll come out of
then
the
it'll come out of the undesignated fund.
Okay.
Some people call it the rainy day fund. If there's
Right.
emergencies that we need to take care of quickly, the money can come out of there. So you can't apply for it like, I'd like my garage finished, so I'll
Right.
apply for some funds.
Right.
It doesn't work that way. But when things come up, the town can pull from there instead of bonding for the money.
And if there was a shortfall in the health insurance fund or the workers' comp fund, the place the town would go to take that money from is the undesignated fund balance. So it's like a savings account it's like your savings account or whatever. Putting it simply. For the town, and it is standard practice to have a fund balance that is at a certain level. And if your fund balance falls below that level, the town has repercussions of getting a lower rating in the bond market and things of that sort. Anybody else? Paula?
What does that do to the health balance? To
The health
healthcare?
insurance reserve fund, as was reported to us, is perfectly fine and healthy, has plenty of money in it to draw down. And plus, we have stopgap coverage. So at a certain point, to be clear, we have stopgap coverage that we have to purchase in order, if there's like somebody who has a multi-million-dollar huge health bill, we're protected. Tracy?
I just, as a board member, I'm concerned because our employees are one of the larger contributors to this fund, and so I have a hard time sitting at a negotiation table telling them we need to increase their contribution every year, even if it's just by a little bit, when the town is then taking the money out and moving it somewhere else. So I just want to be honest with, the people that are sitting here and the people that are out there watching, that we can't keep asking our employees for more if there's such a surplus in this, and it's going to affect contract negotiations ongoing. And I'm concerned with asking our employees for more when they've been doing so much, especially lately, especially in the healthcare, field, and then saying that the town's just putting it in an undesignated fund. Makes me very uncomfortable. I gave you a call earlier to have this conversation with you, but I wanted, everybody on the board to know that it makes me very uncomfortable that this transfer had occurred. We get very little say in it, even though we're the biggest buy-in. And then when we go to people in the town council and say, we'd like to explore other options for insurance, such as the state plan, so far we've not been given a positive reaction to that conversation.
Tracy, you know that I agree with you on this, and we talked about it earlier today offline. We did talk about it at the Finance and Audit Committee meeting, and I do plan on, once Rita gives me the actual numbers, and we've also asked for a breakdown of what percentage of the health insurance benefits are paid by the employees versus the budget. And also, there are retirees, it's not the same across all the different units that we have in our bargaining units. But I want to have all that information, and I want to go to the town council as the chair of the Board of Ed and talk about this with them in a public manner.
I just think that everybody at this table should be aware of where the funds are going before they're gone there. And I know you said we have, limited ability to make those kind of decisions, but I think that everybody at this table should understand where that money's come from and where it's going to before it's allowed to go out. And I know there's a tri-board kind of thing going on, like you, Mark, and I sat on for a while, and I know there was discussion there, but I don't think that it should be a unilateral, okay, this is what we're going to do. After, things that happened in the past that looked unfavorably on us, now suddenly money's getting moved around at will. So I just want everybody to at this table, that's most of the reason why I brought this up, at the end of your presentation, is just that I'm concerned that these things are happening and we're not being adequately informed, and we're not getting a say in it when we're the largest employer, and a good chunk of our budget goes into that fund every year. So essentially, those could be Board of Ed funds that they're moving into their undesignated fund. So if we're overpaying in that, maybe we reduce that contribution next year too.
I'd like to, actually, Jaime, it's Katina, and then Mary, and then you. Katina.
Thank you, Tracy. I absolutely agree with you, and I feel myself getting upset, sitting right here, because we have very little to say. It affects all of our employees, and I would like to send, if not a board letter, a letter kind of complaining and protesting what's happening and the repercussion that has happened in the past to us, and not having any say. That's like taxation without representation. Sorry for my political statement. But I'm really upset about this, that we don't have a say and we are affected by it. Thank you.
It's Mary and then Jaime. I just want to say that whatever I bring to the town council publicly, I will share those notes before with the board, so you all can have some feedback. And, it will be remote, I think. They're still meeting remotely, so I'll have to go online to do it. But I do plan on saying something in September. Mary?
I just want to point out that, again, this problem about the undesignated fund balance, it's not for board surpluses or for teacher contributions and other employee contributions to healthcare funds to rescue or replenish that. And there are some questions about the way that revenues are generated and things like that in this town that need to be looked at. So, I'm very concerned, and I'm also shocked that we weren't told that this was on the agenda, because I probably would have wanted to attend that meeting. So it's quite uncomfortable, and, these are it's part of compensation packages. It's not taxation, actually. It's not even taxation without representation. So, taxation is the issue, perhaps. So, yes, I do think, and given all of the problems we have had, historically about this self-insurance fund and about, reserves, et cetera, I do think we have to keep on this and be aware.
Thank you, Mary. Jaime?
Okay, I just wanted to say, since Ms. Lambert started the conversation, that I do strongly agree with her, and essentially, I've been honest the times that I have to be. But then, at the same time, for the same token, then I see that Katina and Mary and you have approached it the same way, and I just want to say that we should do something about it. We should ask for clarification, and we should raise our voices for that.
Thank you. Is there anybody else who wants to say anything? No? Okay.
I do.
Katina.
Why is our exemplary finance person not included in these conversations? Why are we not being treated as equal partners? I'm like so basically livid sitting right here. Yeah. Thank you.
And have your arms crossed, which is a hostile position.
Well, call me hostile or assertive. I'm just saying.
Yeah, yeah.
I mean, we have.
Well, Liz, it's a town fund. It is, to be clear, the health insurance fund is a town fund. We are one part of it, but we are not. The way the town charter is written and everything is put together, we technically don't have a vote in what happens at the Board of Finance and the town council level. Yet, we can make an issue of this, and, I think it's pretty clear that we are going to make our voice heard on this. Whether or not we get any results we'll have to find out. Certainly, I would like one result to be that they actually really do agree to go with us and explore getting out of the self-insured fund. Not that we necessarily will make a decision when we see all the numbers to go that route, but we owe it to ourselves to do that. And we have heard from some staff and teachers that this really makes them want us to even check that out even more. So we'll see. We'll see where we end up. Dr. Youngberg, I thought you might want to say something. Did you look? You looked like you were going to say something, not to put you on the spot. Okay.
Thank you.
So Rita's going to get us more information. So when we go before the town council, that we have all our ducks in order, that we know exactly where things are. But we do want to make it clear that we pre-funded the workers' comp and the health insurance fund for this year, and we don't want to get left flat-footed on that by the town. Yes.
I understand we had a town charter revision committee, so nothing changed from this committee that was formed.
Some things changed in the last time we had the municipal election was when we voted on it. And some things, like there was one section of it that didn't get passed, and it had to do with the Board of Finance. Interesting. Anyway, we should keep moving on, okay? That really stirred the pot.
The kitchen's a little hot now.
School.
A little warmth over there? School planning and design
Yes.
hasn't met because there was a lot going on over the summer. And I gave Dawn the time she needed to get the work she needed done. And we are planning on meeting next Thursday, if that works into everybody's schedule. School will be open for a week then. We should know more about what's going on, and I'll have a report at the next meeting.
Thank you. Any questions for Tracy?
No drama in that one.
No. How about policy?
We have not met either. We're supposed to be meeting next month, and I wish I had the date, and I was trying to access the new website on my phone, but to find out about our next meeting, but I can't find, where's the board information?
We'll get
on
it for
there?
you.
It's in there. You have to,
I have to
go
keep looking?
search a little more.
Okay.
Katina?
As a policy committee member, I would like to ask for an update about what's happening with our lawyers and the revision of the policies so that we know where we
Supposed to have
stand.
that for next month.
Thank you.
Okay, well, that will happen at your next meeting, I would guess.
Yes.
And thank you very much. Any questions?
Third, I was gonna say third Thursday, but that doesn't sound right.
Well, it would be helpful.
Keep you posted.
Yeah,
We'll let
keep
you
us
know
posted.
next
Okay.
meeting. Thank you.
Thanks. Remember, folks, we're not having a regular meeting on the second Wednesday of the month because our board retreat is that Friday and Saturday. So there isn't a date for a September 8th meeting, okay? Just so you know. So the next regular meeting will be like, what, the 22nd or something like, I think it's the 22nd, yeah. Okay,
I was just informed that our next policy meeting is the 23rd.
okay, the
September.
23rd. Thanks.
Thank you.
There's been no executive committee meetings since we last met, so there's nothing to report there. Is there anything to report, Paula, on the ad hoc elementary school consolidation committee?
Not at this time. I'm going to try and make arrangements for a couple of the final tours that we have, and then get an update, which we'll be doing at the board retreat as well, to come up with some ideas about school closure.
Okay, thank you. Any questions for Paula? Okay, the next item on the agenda is discussion. Earlier today, I forgot to send this out, a reminder out earlier, but earlier today, Janet Testa was nice enough to send you all an attachment with the document that we need to use for our board self-assessment. So we do have time set aside on the agenda at the board retreat to talk about the results of that assessment and help us jointly come up with priorities for our work together in the coming year. So my suggestion is that everybody fill out that form and get it to me, I'd like to say by the 3rd of September, so that I have some time to compile and I might work with Mary on this. Oh, that's next Friday.
Next Friday.
Yeah, okay, well, I would like, how about we say Monday, oh, do you want to give it to me by the 7th? So at least get it a couple days before the. Okay, we'll try for the 3rd. If you can't do the 3rd, let me know, and I might give you an extension.
No.
And so the only reason I want to have that information is so that I can cull through it and share a more complete overview, rather than each of us individually going through our results, which would take way too long. Does that make sense? Yes. Okay.
Are you coding this somehow, because they have numbers, you have scores.
Yeah.
Are you going to work on scores or something?
I'm going to figure out where we fall in those, and there's a lot of place for comments on that form. So if there are themes that come up, that's all I'm going to be looking for, right? Are themes.
Not the scores.
And the scores, yes. Okay, so we can figure out where we are going into the discussion. Does that make sense, Jaime?
Yeah, makes sense.
Okay. Great. Any further discussion on this or questions? No. Okay. Yep. Somebody say? No? Okay. So now we're on to action items. We got this information in our packet. I would entertain a motion for approval of reappointment of Dr. O as the medical advisor.
So moved.
Moved by Brendan, seconded by Katina. Is there any discussion?
Dr.
Yes.
O is the current one?
Mhm.
Okay.
He's the one we approved last year, I believe.
Right. They use him a lot. They ask a lot of questions.
Is he on the district? Does he reside in the district? Or?
I'll let Suzanne answer.
He's currently assigned as the pediatrician, the only pediatrician at Generations, and he works as our medical advisor. So each district is required to have medical orders. He writes our medical orders that our school nurses follow here in district.
Thank you.
Any other questions? Okay. All those in favor of the motion, please indicate by raising your hand. Any opposed? Unanimous. Okay. Next item is approval of acceptance of a donation of EMS supplies by the Windham Fire Department. Entertain a motion. So moved by Ilda,
Second.
seconded by Jaime. Any discussion? All those in favor, please indicate by raising your hand. Okay, unanimous.
The fire department has been wonderful to us.
They've been good partners.
We appreciate them.
Quick question. What are specifically these FNMS?
They're in the.
On page 44 is a list. You want to see it?
A Ferno cot, a scoop, I don't know what a scoop is, a heart start defibrillator, defibrillator pads, CPR mannequins, EMS oxygen bag, medical bags, backboard, and a file cabinet. Value of the goods is estimated at approximately $3,000.
Okay,
It's going to be used in our health science pathways, yes, that's correct.
the next item is approval of acceptance of a donation of school supplies by Monica and John McCracker. Moved by Ilda, seconded by Tracy. Any discussion?
Yes.
Yes.
Where are they going? Where are the backpacks going?
They go to, they're for one particular school, and I can't remember which school off the top of my head.
Actually, that donation is going to be district-wide. It's going to be divided amongst
district-wide.
all schools, yes.
Okay. I thought I read that it was one school, but it's going to be district-wide.
That
Okay.
is another donation that the middle school got.
Okay, okay. So does that answer your question, Ilda? Yes. Any other questions, discussion?
Big thank you.
All those in favor indicate by raising your hand. Thank you. Unanimous with a thank you to both the donations. Now we have to have a motion to approve the budget transfers, which total the recommendation from the Finance and Audit Committee. I can't remember what they total. The year-end one. Rita, can you talk into a mic?
I'm looking it up from the.
I just want to make sure for people who are watching and following that we have the total.
And of course, I don't have it on my screen. I know it was in the packet of the Finance and Audit.
Is it the $2,089,161.46 that was included in our packet?
Yes.
Yeah.
Yes.
Yes. Thank you.
So I'll make that motion.
Tracy is making the motion. Anybody seconding it? Katina? Any discussion? This is really just resolving the year-end closeout. Okay, all those in favor indicate by raising your hand. Unanimous. Thank you. And the final item on the agenda is public comment.
It's a question about the act, the Public Act 19-12, about studies of Blacks, African American, Puerto Rican, and Hispanic studies. I should have wrote it down so I can get it correctly, so I apologize. So my question is, now it's just going to be an elective. Now how are we going to enforce that? The kids, how are we going to, not enforce, but encourage these kids to take it? Number one.
You're bringing up a whole topic of discussion, so it's not really on the agenda, so we're not going to discuss it, but if you would like to just pose a quick question and ask that it be talked about, would you like to be a report to be given on it or a discussion at a future meeting?
Yes.
Okay.
You want additional information on that?
Yes.
Got it.
And we can put it on the agenda too, if you would like.
Yeah. Because it was part of our packet this week.
Yeah, I'm just trying to be better disciplined about us not taking up topics that aren't on the agenda.
It's okay. Yeah.
There's,
Go ahead, Mary.
there's also the opportunity at the retreat when we discuss curriculum, I think, to talk about that.
Good question. Good point. And you got a couple people on the board who agreed, so we'll make sure we get to it. Okay? Is there anybody who's said they'd like to speak during public comment? No? Okay. I didn't see you. You're behind Brendan. Okay. So hearing none, I'll entertain a motion to adjourn.
We move.
Meeting adjourned at 8:10, 8:11. Thank you.
Good luck tomorrow, everybody.